served on a platter for that right hand right there. And look at
Hey, Dr. Masterson, board certified ENT and facial plastics. Had to do a video on this because his way of responding to that punch was too good not to. So let's talk about mandible fracture. So this is his CT. He's got a left parasymphyseal fracture, that's right here. And then he's got a right body fracture, that's right here. A little bit more than half of all mandible fractures are single site, but occasionally, right at under half, happen at two sites. Theory is, I'm going to use my Funyun here, is something called the ring theory. So when I break this, it's impossible to break it. So let's say I push right here, watch, I push here, because it's a ring. It's almost impossible to break a ring in one spot. Now, there's been a lot of debate on this in the literature. So how do you fix this? You do something called ORIF. So on the primary site here, you make an incision in the gum line here. You expose, wipe off all the muscle, expose the jawbone, and then you plate 2 plates on the fracture line and below the fracture line to stabilize it, and then put another one on the secondary side as well. Now, does he have to drink through a straw? So drinking through a straw is required when you fixate the jaw. That's called mandibular maxillary fixation. That's where you tie these two things together with plates, and that's usually on for 4 to 6 weeks. That's required usually in a couple cases. One, if the fracture was 72 hours ago, several days ago, or if potentially there's a comminuted fracture where there's multiple fracture lines, not just a couple. In the case like Jake's, where he's got 2 fracture lines, he's got it, they were able to plate it, especially these parasymphyseal and body fractures. They're not high on the angle or the condyle of the mandible. MMF is generally not required, just adhering to a soft diet. So here in about 2 to 6 weeks, hopefully his surgeon will take him off that soft diet and he'll be back to getting punched in the face again. So tip of the cap to you, my friend. If this helps, don't break your jaw. And can we just watch how he responded to that one more time? Epic.
there. And look at
Not how I would respond to a mandible fracture. Well done, Jake.